Good afternoon and hello, good morning in other parts of the world. I am Amelie Ekwe. I'm the Academic Dean of globeethics.net, and I have the privilege to welcome you to this first Blue Table webinar of the globeethics.net Academy.
Thank you for the previous speakers. They did bring the idea into perspective. So I would like to just share from my experience 3 points. The first point is that when we were looking at the question of public health and solidarity, basically what occurred to me was that it, against a background of an already present solidarity, against a background of an already present community, people were able to gather together and sort of be in the ethical world. There were lots of acts of immense kindness, immense sharing, immense community building. Our medical staff in the hospitals have gone way beyond their duty to be the messengers of health that they were. So that is my experience in India. But against the same backdrop, the inequalities that were there in society already showed up. So when we say pandemic, it's supposed to hit everyone similarly, but unfortunately, inside our country, it didn't hit everyone equally. It hit some people more. You've heard of the migrants who walked kilometers because they're people are still not recovered from that. So it hit people unequally. And one of the other things about India that was very, very important was that we were all in a movement of activism where people were gathering in large numbers to protest against certain injustices that were done to them. Particularly like some citizenship rules were there. Now we're having the farmers' protests. So in light of that, what actually happened was when people started talking about physical distancing and being safe, the people were so much affected by the inequalities and the kind of difficulties that they had that they chose to ignore the threat to their life and still fight for their rights. So I don't know where we should place this kind of idea of social ethics, because it becomes that a pandemic doesn't bring in a new set of problems, but it exposes the problems that are already there in the system. And I think what happens to us is when the pandemic comes, we get very busy dealing with the pandemic and the responses to the pandemic. But what the pandemic has done is to expose the problems that were already there. And a case in point is the air pollution levels in India are so high that if the air pollution levels had already been handled as a problem earlier, the kind of seriousness of pandemic in polluted areas, the number of people having respiratory disorders would have been much lesser. So if there's already a problem of hygiene and cleanliness and availability of soap, then probably, it's like instead of a response to the pandemic, an ethical response to the pandemic, I personally feel that if we had already tackled the problems that were being ethical all the time and not just in the context of pandemic. And so there's a learning from the pandemic. It's like somebody has torn apart our and shown a mirror to us. So I feel that is something which I would really like to think about, like how can we be socially responsible and not just, respond immediately when the pandemic occurs. Thank you, Emily. Those are the 2 points I wanted to make.